the beginning of last week, the NCR posted over 460 new COVID-19 cases that nearly doubled the next day and easily multiplied close to sevenfold, or 600% a week after. But even with the country in the cusp of a major pandemic relapse, the government's pandemic response team is confident to keep the spread in check with vaccination rollout at its peak, an imminent lockdown to be put on the vaccinated, and an intensification of its prevent, detect, isolate, and treatment strategy. Our Mark Fetalco has more.
The Philippines is back to being high risk for COVID-19 following the sharp increase in the number of cases. According to the Department of Health, the country had an average of more than 300 daily cases from December 20 to 26. The following week, the average number of cases jumped to more than 2,000.
Alam po natin na tumaas ang mobility, ang atin pong compliance to health protocols ay medyo bumaba, lalong-lalo na nag-umpisa na po itong ating holiday rush. So this has drove the increase in the number of cases. Plus kung sakasakaling yung assumption natin ay totoo na may Omicron na, mas bumilis po ang transmission ng kaso dahil dito.
Based on the latest genome sequencing report, there are 11 imported cases and 3 local cases of the Omicron variant in the country. None of them manifested severe symptoms of COVID-19. All of the close contacts of the first 3 Omicron cases tested negative for COVID-19, while among the 24 co-passengers of the 4th patient, 3 tested positive, 15 tested negative, the other 6 are still being verified.
All local cases were all located and traced and completed their minimum 10-day isolation period and had been tagged as recovered prior to the release of the genome results.
While the healthcare utilization rate in the country and in the National Capital Region remain low, the government urged the public to get vaccinated. Based on the DOH data, 85% of COVID-19 patients in intensive care units requiring mechanical ventilators in DOH hospitals in Metro Manila are either unvaccinated or partially vaccinated.
Lahat tayo, alam natin na ang paraan lang para mapigilan natin to at magawa natin yung nagawa na natin nung nakaraan at napababa natin ang mga kaso, lalo na yung Delta na napababa natin ng mabilis, kung tayong lahat ay magtutulungan at simple lang po, lahat tayo ay dapat magpabakuna.
Vaccine Experts Panel Head Dr. Nina Gloriani also encouraged those who have already received their primary dose series to get booster shots for an additional layer of protection against COVID-19. So far, over 1.8 million Filipinos have received their booster shots.
Pag nakapag-bakuna kayo ng at least isa man lang, meron kayong protection hanggang mga 52% against hospitalization. Pero yung pangalawang bakuna, so yung second dose, kung dalawang kailangan, ay magtataas pa ng protection of about 72% against hospitalization. At ang maganda rin balita ay ang booster, yung third dose, ay nakakapagbigay ng up to 90% na protection against the Omicron variant.
Meanwhile, following a report on the first case of Florona in Israel, Dr. Edsel Salvana of the DOH Technical Advisory Group said the co-infections or 2 or multiple infections hitting one person is not unusual, but he still advised the public to get the influenza shots and pneumonia vaccines in addition to their COVID-19 vaccines. Mark Fetalco for The Nation.